been through all the elimination diet hell myself. I went through all the testing hell myself. I've spent, countless hours, trying to understand all those pieces. These are my own struggles. Getting food certainty around your food with data is absolutely essential. And the data isn't just the allergy testing, which I am a proponent of. You got to get accurate testing for the intolerances, right? But the data is also from digestion, from also your body removal of those foods. And what I teach in the program is the reintroduction of food. So when you're thinking about what's the difference between food sensitivity and food mapping system, this is one way to illustrate it. Is number one, we just talked about the data and testing conundrum. You have to get the right test, which you will in the program. Number two is this is the data mastery training. That's the piece that's missing for patients and for doctors. The training that's provided to understand how these pieces of data all fit together, mastery level, like literally a master's degree level, that providers go through using the same modules. When we certify a provider, they actually go through the same training that the clients go through. This is the data mastery training around food mapping. And then here's what's also missing. A lot of people don't get to troubleshoot then and for one-on-one implementation to look at those results after they've learned the materials, to work with us on a live week where for an entire week we go through results where you not only learn from your results, but you learn what I call hyper learning 10 times fast. Why? You can see other people's results troubleshooted. And I'll give you a perfect example of this. Okay. A lot of people don't even think I have recurrent urinary tract infections and it's related to food. But then they get Jane asking a question or sharing her win. And she said, Jane, this is actually Dr. Maggie. This is my story right now. This is Maggie's story is that I, for years, had urinary tract infections. So bad, like 6 times a year, that I was resistant to every oral antibiotic. And when I got a urinary tract infection, I was in the emergency room. This is before I knew I had food problems. Like I was diagnosed before anything. And one of the things I recognized was when I finally went gluten free, for me, that's one of my allergens. I didn't get any more urinary tract infections.
Aha.
And what happened was one weekend I was traveling and I got accidentally exposed to gluten in a seasoning mix that someone had in the restaurant. And the very next day I had a urinary tract infection, the first one I had in 6 months. And that's when it dawned on me, hmm,
There's a connection.
there's a connection. And you know what? This is going to blow your mind, everybody. Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform Protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. Do you know that in Eastern traditional Chinese medicine, TCM, do you know that the bladder, the kidneys is actually an allergy organ?
No.
In the United States, we think is a kidney renal doctor. It's a blood vessel organ. That's all we think. It's a filtering blood vessel organ. No, it's an allergy organ. And so I started to make these connections because I've done this so many times. And now routinely in our programs, when someone says, I have recurrent urinary tract infections, one of the first things I talk about is this concept. And I'm like, could you be gluten intolerant? What's in your family history? What's in your test results? What's in your digestion? What's in your genetics? What's going on? And I will tell you the rate of women and men with specifically with recurrent urinary tract infections, the amount of people that's gluten intolerant, it's really staggeringly high in that group. But yet gluten intolerance is one of the hardest things to figure out with testing.
This is another factor that I love because not only do you have a classical training and you have a conventional medicine background, so you've got all of that, but you have a dramatic functional background as well. But then you also have this perspective with traditional Chinese medicine that you can bring into it as well. So it's like you are getting so much knowledge and information from you, Dr.
Yeah.
Maggie.
I really love looking at all these different through the lens of these different, branches of medicine. Some of these precede the US medical system by 1,000 years or more. Think about that. Think about that wisdom and that experience. Well, I'll be honest with you. I absolutely know for a fact that the kidneys and the bladder is an allergy organ and can react to food allergens, and that it actually causes inflammation in the bladder and it can cause an increased risk for bladder infections. Period.
And I
And
bet
that's because
no doctor in all of your bladder infections ever mentioned that to you because people are not connecting the dots in this way.
I'm the only doctor who's ever said that. But this is what I think. I like the volume that I've had to deal with. So in a sense, this being my own experience and my own battle, we are, by the way, everybody, think about this quote. We are the greatest teachers in the area of our greatest suffering.
You went through so much and you only touched on a tiny little bit of it today with your own health journey. But it's
Yeah.
because of that. And it's because of your quest for answers and realizing, hey, there's the system is broken. That's a whole nother topic. The system is broken here for somebody who's trying to get help and get to the root cause of issues that you were able to create the transform program and help so many people.
Think that's the missing link. And I'll be really honest with people out there is that, I've been through all the elimination diet hell myself. I went through all the testing hell myself. I've spent countless hours, researching this and figuring out. I've gone through my negotiation with whether I should be gluten free or not. I mean, and trying to understand all those pieces. These are my own struggles, right? And these are my children's struggles as well. So for me, I think that what's missing in how we deal with food reactions and physical health symptoms is everything. We're missing the boat. We are not treating people. We're sending people to the wrong doctors. Even when you think you're going to the right doctor, they are not properly trained. And I am always like, even yesterday when I was going through a review of some of the food mapping results with a group together, I said, "Hold on, everybody. What I'm about to tell you, I was never taught this, and no doctor has ever taught this. But you need to write this down
Mm.
because this is going to be completely game changing for you." And those moments is why I freaking adore those moments, because they were hard earned, but also I love the fact that people need to learn this. They can't keep hugging rocks, hoping it hugs them back, and think and doctor shopping and test shopping forever and ever when their lives depend on this. To learn more about the food mapping system and my food mapping masterclass, click the link above or below this video.